Hello, my name is Melissa Smith. I'm on faculty at UT Southwestern in Dallas, and I'm here today to talk to you about distractions and 5 ways you can minimize interruptions on your shift. So to give you an example of my typical shift, I sit down at the computer, the nurse needs a medication order for something, the resident sits down and says, "Hey, Dr. Smith, I've got a quick patient to tell you about," and the EKG tech pops up, says, "Hey, I need a STEMI, no STEMI." And this is about 5 minutes into a 9-hour shift. So we know that distractions are everywhere, and kind of like this dog here, we're really focused on one thing, and what happens? Somebody comes along, they interrupt us with something else, and we're immediately distracted. So there's been this is actually a study, interruption science, where they've looked at a lot of different outcomes and how interruptions affect the workplace. And some things they've found is that it leads to decreased productivity, poor outcomes, increased cost, and increased stress levels. Specifically in emergency medicine, this has also been looked at, and I draw your attention to a recent study that came out. And they looked to see how they monitored physicians for 2 hours, and they looked to see how many interruptions occurred during those 2 hours. And the outcomes they measured were to see how many times would the physician actually stop and engage in the interruption versus reject or delay. And what they found was that physicians were interrupted an average of 12.5 times per hour on shift. They stopped to engage in the task 75% of the time and only delayed or rejected the interruption less than 2% of the times. And this has real implications in our everyday working environment, both on a personal and an institutional level. On a personal level, it can lead to increased fatigue, burnout, irritability, exhaustion, and it also has implications like within our hospital and institutions as well. And some of those effects manifest themselves as delays in patient care, decreased productivity, decreased patient satisfaction. It can lead to poor outcomes and medical errors. So we can't avoid distractions. They're inevitable and sometimes they're necessary, but we can come up with some strategies for minimizing them on our shifts, and that's what I want to go through today. So the first one that I'm going to talk about is not so much as how to avoid them, but an awareness that we need to have, and that's dividing tasks into linear versus nonlinear completion of tasks. Some things don't have to be done in order. Like charting, we can come back and forth, but things like putting in medications, handoffs, sign-outs, those are things that really need to be done right then and there. This is not the time to be interrupted, and so we need to have an awareness and watch out for these linear tasks, and we can mitigate some of those medical errors and bad outcomes if we're more aware that these things and what needs to be done in a linear order. So how do we do that? Well, one strategy we can employ is don't be afraid of the words wait and no. A lot of us times we don't want to use this because we're afraid that we'll be perceived as, angry, grumpy, something like that on shift. But in reality, you don't have to say it in a mean way, but it's okay to sometimes say, I'm right in the middle of handing off this patient, or we're signing out now, can we please wait a second? And if you create a habit of when you're going to use these words and when you're going to use these strategies, if you'll encourage the residents, you'll encourage other staff to do this, you can change the culture and encourage people not to interrupt you in more vulnerable situations. So don't be afraid of the words wait and no. The other strategy I would say is find your hiding places. I sit somewhere like this where it's out in the open, but there's all kinds of things going on. Someone wants a room, a sandwich, somebody wants to be discharged, there's nurses, EKG techs, and what happens? I become a sitting target. And there are all kinds of things going around me. However, if you will find somewhere, that you can work maybe smarter or harder, not the whole time, but, we need to get something done. For me, this is on the other side of these doors, because who's on the other side of the door? The patient, and it might just be me, the nurse, the resident, and there's a computer in the room, and I can work a lot more efficiently and decrease the number of interruptions. The other thing you can do is identify your deflection army. I don't mind getting urinals, blankets, sandwiches, but sometimes it's not the time for that, and I need to get something else done. There are lots of people around, and if I can utilize those people to help me redelegate tasks, that's a big help. You can also redelegate these, other tasks you find to the residents and consultants, depending on the task. And I would just give the caveat that it's always important, learn the name of your techs, learn the name of your nurses, because it's much better to ask these people, hey, Jackie, I see you're taking care of bed 9. Can you get them this or that? The last strategy I would say is to utilize your return, like what I call your return to Zen moments. So realize when an interruption is causing an interruption. Sometimes something gets said by a family member, a patient, staff, and it upsets us. And what we don't realize is that that's causing an interruption in and of itself, and we're unable to do anything else because we're so focused about what just happened. If that's the case, take a mental break, even a short one. Like I said, I work at a county hospital. We don't have a doctor's lounge, so sometimes that's just a quick escape to the bathroom, the ambulance bay, wherever I can find, just to clear my head for a second, get away from everyone else, and then I can return and be more productive when I'm back in my workspace. So in summary, just to recap these points, identify the linear versus nonlinear task. Don't be afraid of the words wait and no. Also, find your hiding places wherever they may be and think where you can work smarter. Identify your deflection army and utilize your return to Zen moments. So I hope you can all take some of these strategies back on your next shift and have a decreased number of interruptions. Thank you.
Thank you so much.
All right. Yeah, thank you so much for your presentation. I really appreciated how relevant your points were, and your slides were well organized and not a whole lot of text, which was awesome. Thank you.